The thought process that colon cancer is an old person's disease, that has to be thrown out of the window. At this point, because of how many instances are happening for people in their early 30s, for all of us around the same age to be running into the same type of cancer, that means something. Hi, my name is Janaylon Wright, soon to be Williams. I was born and raised here in Philadelphia. Go Birds. April to May of 2022 is when I started having pains in my lower left side. I went to an emergency room and they told me that they were not sure what the pain was and just to, see if it subsides, take over-the-counter medicine. Probably like a few weeks later, I went to a different location. By this point, I was in pain at work consistently, literally hunched over to the point where my supervisor kicked me out of work and said, "You need to get this figured out." And that's when I was diagnosed with the fibroids. I was at my grandmother's house and she was cooking for me. And then that is when I was not able to keep food down. That's when I started throwing up. And it was getting late at night. And I remember I went and got a glass of water and I couldn't keep the water down. And when I threw up the water is when I really realized that this is a severe problem. And we went to Jefferson Einstein. They ran a bunch of tests. They come back with the test results. And that is when I was diagnosed with colon cancer. So in that moment, my thought process was just like, okay, makes sense. What's next? I love my grandmother. A thing takes over where you're like, I have to make sure she's okay. So I'm like, we are gonna get through this. This is fine. We can do it. She was coming up to the hospital every day. So for her, this was shocking. But I'm like, no, we got it. After the surgery, we got a call in reference to the results of it. I was actually diagnosed with stage 3 colon cancer. And I cried. That was the first time during this entire process that I broke down into legitimate tears. Because I didn't know what to do. Ever since I was young, my mama was like, come to me with a problem, but also have a solution. And I did not know what to do. The next steps were chemo now. My doctor did inform me about immunotherapy trials, clinical trials. He said he honestly thought it would be a good idea for me, but the idea of the chemo settled better with me. Chemo is not fun. You learn a lot. There are things I couldn't do. I couldn't drink cold things. It was rules and restrictions all for my health because of how it affected your body. But I had an amazing team. They walked me through everything I needed to do. And during this time, I was just trying not to be scared. I was trying to focus on all the steps I need to take and the things I need to do to make sure that I can beat this. Being an African-American young girl at this time, there is not a lot of research that was available for me for how colon cancer would affect me or the things I would need to do. So I was trying to find what I can and do what I can to make sure that I was as healthy as possible. It was a lot of dietary changes. Oh, that was the worst part. It was so tragic because I love food. My family loves food. We love to cook, we love to eat. My husband, who was then my boyfriend when I was diagnosed, has been here the entire time. I remember before we got married, I said, we've already been through sickness and health, so it's not much more that we can do. He can't leave now.
He was officially cancer-free. Janaylon Wright.
Now I'm doing pretty good. I went from following up with my oncologist every 3 months to now only having to follow up every 6 months. So I'm improving, yay. You have to go through 5 years of remission before you're considered completely cancer-free, and I've gone through 3. So I'm very happy about that. The money that is needed to fund any type of research that can be given, definitely. For all of us around the same age to be running into the same type of cancer, that means something. There's an issue there. There's a specific demographic. There's something that was happening that has to be researched. I even gave my DNA because anything that you can find, use whatever you can to help the next person. You need to know where to start. Knowing where to start, it comes from research. It comes from funding for that research. All of these things will lead us to closer to a cancer-free world.